a really important part of the therapy, that if you're somebody who is finding that they're worse after they push themselves hard, that to remember these three words: stop, rest, pace.
Welcome. Today, we are pleased to have Dr. Eunice Yu. She is an internal medicine specialist and a primary care doctor, and she is the founder of Henry Ford COVID Recovery Care Program. And today we'll talk about the primary care doctor and post-COVID complications. So welcome, Dr. Yu. Thanks for
having me.
Yeah, you're so welcome. So let's talk about when we have patients who had COVID-19, which we have a lot of those patients now. So what are the things that the primary care doctor evaluates? So when do you see your doctor for post-COVID complications?
Yeah, that's a great question. So every virus, you usually have some recovery time, and the usual expected recovery time is within 4 weeks of the start of your infection. And so what we're calling post-acute sequelae, or prolonged symptoms of COVID-19, can start as early as 4 weeks after your acute infection. So after about 4 weeks of your infection, if you're still having symptoms like shortness of breath, brain fog, severe fatigue, GI symptoms like diarrhea or nausea, those are things that people might come to their primary care doctor to figure out what's going on.
Excellent. I think that's very reasonable for you to see a primary care doctor if things are not improving and lingering after 4 weeks. So that's a good timeline to just give it time to recover. If it does not recover, then you need some evaluation. So talking about evaluation, what are the things and tools that you do to evaluate patients when they come to your clinic with post-COVID-19 symptoms?
Absolutely. So it depends on the symptoms. We know that long COVID can affect multiple organ systems. So if someone's short of breath, we really want to make sure that there's not still lingering changes in the lung. We might do lung function tests. We might do a walk test or some additional imaging if there was initial pneumonia. So for shortness of breath, there's a good, sort of evaluation pathway. Same thing for chest pain. Same thing for stomach issues. And then we may also do some overall evaluation in terms of how is this affecting your quality of life? How is this affecting your social interactions? How is this affecting your mood? And so those are all things that go into that holistic primary care evaluation. Sort of what people come to primary care for is that comprehensive approach.
Yeah, that's excellent. So it all depends on the particular symptoms that they have. So whatever the symptom that you have, you will tailor your evaluation. So what are, in general, what are the available testing that you can do for people who have COVID-19 and they have lingering symptoms?
Yeah, so we may start just with some basic blood work and kind of looking at making sure that just the electrolytes are good, that there's not something going on with kidney function, that maybe we may look at some inflammatory markers, some basic sort of endocrine or thyroid type things. So it depends on the symptoms too. So if somebody is having trouble with thinking, we may make sure that we look at all the reversible things that we can address. For example, making sure that there's not an underlying B12 deficiency or anemia that can contribute to fatigue, that sort of thing. And then we may go further again, depending on the symptoms, such as, a lot of the things that we order to evaluate shortness of breath. We may do some cognitive function testing. We may look at, a thorough review of the medications that you're taking to make sure they're not contributing or making things worse. So those are kinds of some of the ways that we may look at someone who is having these symptoms, making sure we're optimizing as much as possible everything we can do to make sure that the symptoms are as not bothersome as possible.
Nice. So when we talk about the lingering symptoms, what are the most, we can talk about like a domain or a system that is involved in COVID-19. So what are the systems and complaints that you usually see when you see your patients in the clinic?
Yeah, the most common ones, honestly, are shortness of breath. Sometimes people will have flares of pain. So if they have underlying arthritis, we may find that those are flared up. People report a lot of brain fog, difficulty with thinking, just sort of completing tasks, staying like with concentration and paying attention to things. And there's also, I think, we don't want to attribute all the symptoms to anxiety. That's certainly not appropriate. And also, I think it's important to acknowledge that there is a, there's an impact on people's mental health from having these symptoms. Difficulty with coping, sometimes some PTSD from having friends or family who are affected, or some survivor's guilt. That's not going to cause shortness of breath necessarily, but it can contribute to how people feel as they recover.
Right. Yeah. So usually when I see patients, the list of symptoms and complaints is very long, especially at the beginning. So how do you navigate that? Like usually they have so many symptoms involved because COVID is a multi-system disease. So how do you navigate those lists and kind of like the direct evaluation?
Yeah, it's definitely tough. And I think it's important to get that full list, when you get started, so you get a sense of the spectrum of what's going on. And then I think it's important to have a conversation about what is affecting you the most, right? So that you can start with a prioritized list and start chipping away at the things that are creating the biggest impact on the quality of life. So, if it's shortness of breath the most, or if it's the thinking, or if it's the fatigue, what aspect should we really focus on in order to, get the most bang for your buck, and then start working down the list.
Right. So you start with one symptom, or like most bothersome symptom, try to work on that, and then move to the next and the next. And it seems that your patients will need lots of follow-up, or they will need some longitudinal care that people will get evaluated multiple times. So is that true?
That's absolutely true. Yeah. I mean, every patient is so different in how they present. Many patients have no shortness of breath at all, but are dealing with a lot of GI symptoms, or they're having mostly neurologic symptoms like brain fog, tingling, headaches, but they have no, GI or shortness of breath symptoms or chest symptoms. And so, the way that I think the take-home message is that this therapy needs to be tailored to what that patient is experiencing, and that it can be unpredictable. We're seeing situations where people get a little better for a while and then they have a flare up again. And so it does require that continued touch point, and knowing that you have somebody on your team who's going to be accessible and is going to be helping you to coordinate across all these different organ systems, and also following your symptoms in a structured way so that you kind of have a record of what's been happening.
Talking about the flare-up, what are the things that can worsen the COVID-19 lingering symptoms?
Yeah, that's a great question. So I'm not sure that there's a solid list of things that lead to flares. It can really depend on the person. So one thing that some people are experiencing, and not everyone, but some people experience, is that if they overdo it, they may experience a flare. So, they may start to feel a little better, and then they really want to kind of go back to maybe how they thought they were before. And then boom, the next day they're in bed, and then they are struggling for days or weeks afterward. And a really important part of the therapy, that if you're somebody who is finding that they're worse after they push themselves hard, that to remember these 3 words: stop, rest, pace. And pacing is this concept that it's not that you have to sprint, but then you're taking 1 step forward and taking 3 steps back. You really want to sort of not hit that limit. You always want to be at that 60% in terms of your exertion, so that you don't push past what your body can handle. And that there may be a time where, as you're feeling better, that can change, and you'll be able to do more and more. But if you're always finding that you're setting yourself back, then you're never going to make that progress that you need to make. And so it's really hard in our culture, because we're all, tending to hustle and go, go, go. And it's hard for a lot of us to do that. It's hard for me to do that. But that is something that, working with a good physical therapist or rehabilitation specialist, you can kind of figure out, how do I know when I've pushed myself too far? How do I know? What do I look for? What are some things in terms of my heart rate or my breathing, how I'm feeling, that I can check in on to make sure that I'm not going so pushing myself so hard that I'm going to take a couple steps back afterward.
What are the available treatments for post-COVID-19 symptoms?
That's a great question. So the treatments right now are really individualized to symptoms and optimizing symptoms and function. There is no scientifically validated study on one treatment that will make all long COVID symptoms better. There are people out there who are trying out different protocols, but there's no good study that any of them are really effective right now. And so the best bet is to sort of get connected with someone who can connect you to the people who you need on your team to optimize your symptoms and function as best as possible. The other thing I'll say is that there's emerging evidence that vaccination may help to improve long COVID symptoms. There's ongoing studies about the exact group of people that's going to help, but in early reports from patient support groups, the vast majority of folks either have no change in their symptoms or get dramatically better.
So when do you advise people to get vaccinated after having COVID-19 or lingering post-COVID symptoms?
Yeah, that's a great question too. So I recommend getting vaccinated, as soon as possible. So after 4 weeks of your infections, even if you're still having some symptoms, it's a good idea to, discuss vaccination with your provider and seek out vaccination. It is something that is going to continue to protect you, boost your long-term immunity, and there's no need to wait like 90 days or anything else to get that vaccine.
Excellent. So you can get vaccinated early, and most of the people will improve after getting vaccine or not have any changes at all.
Absolutely.
All right. So you say that there are lots of symptoms, and some of them are probably like harder to control or difficult to control. So when do you decide as a primary care doctor to refer to a specialist? So like, for example, I'm a neurologist, and then sometimes it reaches me when the cases are difficult. So how do you kind of prioritize that and choose which and when to refer to a specialist?
Yeah, that's a great question. So there are some evaluations that we can't do in primary care. There are some treatments that we can't do in primary care, and those are when we refer to specialists. So, for example, for neurology, if somebody needs cognitive rehabilitation, if somebody has persistent symptoms and we've done the initial testing and we don't have a diagnosis, or we need additional help in terms of understanding the diagnosis and developing the treatment. So those are examples when we would definitely refer. So, for example, if somebody had shortness of breath and we found that there were some scarring changes on the lungs, we'd want that to be seen by specialists for that long-term expertise and follow-up.
Right. So you try the initial treatment and evaluation, and when things are a little bit more complicated, you would like to get an opinion from a specialist so that they can get more evaluation and more specialized treatment.
Yeah, absolutely. And part of our job in primary care is to be that coordinator and to help quarterback, right? So especially if somebody's having multiple symptoms across different organ systems, it can be overwhelming to say, go to these 10 specialists. That is really hard for a lot of folks to kind of coordinate and schedule. And so part of what you can work on with your primary care doctor is understanding, what should I go to first? Who should I go to next? How should I organize like my testing compared to when I see the specialist? And what does the specialist have to see? What does the specialist need to have ready when I'm there versus what can be done after, or what can they order? So that way your care is streamlined and as unburdensome as possible.
Right. I think for me as a specialist and neurologist, I would love for the primary care doctor to kind of like get the initial evaluation and treated all the metabolic and other underlying medical conditions, optimize diabetes and hypertension and all of that. And then if things are not improving, then we kick in and do the evaluation. But that's much better than start from the beginning and do all the evaluations at the clinic, because you want to think about your patient, because it's easy sometimes to just send a referral, but the patient has to go and make an appointment and sit in the clinic and waiting room. So the less referrals, the better.
Absolutely. The goal is to get you on a platter as a specialist, kind of the patient who has all the imaging, the lab work, and sort of the workup done as much as possible, so that when the patient goes to see you, they can leave with a plan rather than a whole bunch of other things to do.
Yeah, and can you tell us more about the Henry Ford COVID Recovery Care Program, and what are the services that you provide and the things that you built in that program?
Absolutely. So at the Henry Ford COVID Recovery Program, our goal was to really put primary care at the center of the relationship with the patient and support that coordinated care to reduce how confusing and difficult it can be to do your own care management. So we are supporting all of primary care to understand what long COVID is, be able to manage the symptoms and start the workup. And then if anybody gets stuck, they have access to our program. They can ask questions and we can kind of recommend additional steps. And if there's complications or if there's additional things that are needed, we also have a multidisciplinary case conference, which is a group of over 11 specialists who get together, review cases, and kind of provide additional perspectives on the care plan to make sure it's as complete and optimized as possible. In the long run, we're going to keep making it better and add in additional navigation resources and access resources.
And what are you doing to improve access and improve capabilities of all the primary care doctors in the system?
Absolutely. So we've had continuing medical education resources. We've built sort of standardized resources and symptom pathways to help evaluate the most common symptoms in long COVID. And we've also built some tools to make it easier for primary care to assess the symptoms and follow their patients over time.
That's very nice. I think one of the most important things to do as a program and center is to empower and increase the level of all your providers so that all of them will become good and understanding all the post-COVID symptoms so that they can manage things in their own clinic rather than just wait on other doctors to treat patients with. So those CME, the continuous medical education lectures and referrals and consultations, that helps a lot to empower everyone and build their strength and knowledge.
Absolutely. Yeah. My goal is for patients to experience less frustration as they're trying to navigate their care for this condition.
And what are you doing in terms of research and advancement in our understanding of post-COVID-19 symptoms?
Yeah, great question. So we have partnered with our public health sciences at Henry Ford to do a couple things, including a patient advisory council to make sure that we understand the experiences of patients with long COVID and they can help continue to inform the care that we're developing, as well as partnering with epidemiologists and other researchers to kind of understand better what long COVID really is and how to better treat it. We're at the stage right now where long COVID is still being defined. We're still understanding what are all the different categories of patients who are experiencing these symptoms, and how do we make sure we're addressing some of the root causes and not just the symptoms, which is kind of what we're focused on right now. So that's kind of the direction that we're going.
That's a great, because one of the most important things is not just treat patients, but advance science and improve our understanding so that we benefit everyone by better understanding and come up with better treatments and evaluations for our patients to benefit.
Absolutely. Yeah. And it's so critical for this condition where we still have so much to learn.
Yeah, definitely lots of things to learn, and it was a good journey and so far, and we're just scratching the surface. And so what are other advice that you have for our patients and other primary care doctors who are seeing post-COVID-19 patients?
Yeah, so my advice is, as a patient, to talk about how important vaccination is to those who haven't been vaccinated, to prevent them from experiencing what you're experiencing. Your voice can be really influential in terms of stopping this pandemic from spreading, and also the second wave of now long COVID symptoms. Get help early by finding a team that will work with you to address these symptoms, because there are things that we can do to improve your quality of life. Get connected to others through long COVID support groups. There's many of them out there, and they are a powerful voice in terms of the medical community understanding and taking this condition seriously. And they can be a real source of comfort and just a sense that you're not alone, because you're not. There's a lot of people out there who are experiencing this. For other primary care doctors, I would say make sure to listen and take the concerns that your patients are expressing seriously, because while we don't know exactly what long COVID is or exactly which symptoms are, yes, this is long COVID versus no, this is not long COVID, we may not always be able to pinpoint those, but there are definitely things that we can do to address them, tools that we already have, and reach out for help from programs around you that if you don't have one at your institution, but reach out to programs around you, because we're all interested and want to learn more and want to help out and share the knowledge that we have. So, yeah.
It's great. Well, thank you so much for talking to us and discussing all those wonderful aspects of primary care evaluation and treatment after COVID-19. And for all of you out there, we created a whole list of things and videos. So make sure to check those videos for more information and evaluations for long COVID-19 symptoms. Thank you, and see you on the next one.